My name is Chloe Hayes, and at 32, I thought I understood the delicate balance of trust that keeps a hospital running. As the charge nurse for the cardiac telemetry unit at Silver Lake Hospital in Mirror Heights, Colorado, I'd spent 8 years building relationships with my team, learning that in healthcare, trust isn't just professional courtesy. It's the foundation that keeps patients safe and staff functioning. Silver Lake Hospital sits nestled against the Rocky Mountain foothills, a 400-bed facility that serves our mountain community with the kind of dedication you'd expect from a place where everyone knows everyone. The morning shift change at 6 a.m. had become my ritual, arriving early to review overnight reports and ensure our 20-bed unit was ready for another day. The familiar hum of monitors, the soft conversations between nurses, and the quiet efficiency of our team had always felt like home. But lately, something felt different. It started with small things. Overtime schedules that didn't quite add up, staffing assignments that seemed to favor certain people, and a growing in our usually harmonious unit. As someone who managed both patient care and administrative responsibilities, I developed an eye for patterns. The numbers weren't matching the reality I observed on the floor. Ryan Jackson, my certified nursing assistant for the past 3 years, had always been reliable. More than reliable, actually. He'd become indispensable. When I was promoted to charge nurse 18 months ago, Ryan had stepped up to help with scheduling coordination and budget oversight. He managed the unit's staffing budget and overtime assignments, a responsibility I'd gradually delegated to him as my administrative duties expanded. Ryan had earned that trust. He'd worked double shifts during the flu outbreak last winter, covered for colleagues during family emergencies, and somehow always knew exactly which staff members were available for last-minute coverage. His efficiency with our Epic scheduling system was remarkable, and his ability to navigate the complex overtime approval process had saved me countless hours. But trust, I was beginning to learn, could be a dangerous thing when placed in the wrong hands. The first real sign came during a routine budget review meeting with our nurse manager, Diana Jackson. She'd pulled up our unit's overtime expenses for the quarter, her brow furrowed as she scrolled through the data on her computer screen. "Chloe, your unit's overtime costs are running 20% higher than projected," she'd said, turning the monitor toward me. "I need you to review these approvals and explain the discrepancies." I'd stared at the screen, recognizing my employee ID number next to dozens of overtime authorizations I didn't remember approving. The timestamps showed approvals happening during my days off during vacation time, even during hours when I was in patient care meetings. My stomach had tightened as I realized the implications. "I'll look into this immediately," I'd promised Diana, but even as I spoke, a cold certainty was settling in my chest. That night, I'd gone home to my small apartment overlooking Mirror Lake and sat at my kitchen table with printouts of the overtime reports. The pattern was clear once I knew what to look for: systematic, calculated, and devastating. Someone had been using my credentials to approve unauthorized overtime, and the financial impact was staggering. As I prepared for another shift, checking my badge and reviewing the night's events, I couldn't shake the feeling that everything I'd built at Silver Lake Hospital was about to crumble. The morning mountain air felt colder than usual as I walked through the employee entrance, and the familiar sounds of the hospital seemed muted, as if the building itself was holding its breath. Something was very wrong, and I was about to discover just how deep the betrayal ran. The relationship with Ryan had started 3 years ago, when he'd transferred to our unit from the emergency department. As a certified nursing assistant with 5 years of experience, he'd brought skills that our understaffed unit desperately needed. What I hadn't expected was how quickly he'd become indispensable to our daily operations. Ryan had a gift for organization that bordered on the supernatural. Within his first month, he'd streamlined our supply ordering system, created color-coded patient assignment boards, and somehow managed to reduce our medication delivery delays by 40%. When Diana Jackson promoted me to charge nurse 6 months later, Ryan had been the obvious choice to help manage the administrative side of our unit. "You're drowning in paperwork, Chloe," he'd said one particularly hectic Tuesday. finding me still at the nurse's station at 9 p.m., 2 hours past my shift. "Let me take some of this off your plate." That's how it started. Small favors that grew into significant responsibilities. Ryan began handling our unit's staffing budget and overtime assignments, tasks that required access to sensitive administrative systems. His attention to detail was flawless, and his understanding of hospital protocols impressed even our most seasoned staff members. "Ryan's a godsend," Amanda Wilson, one of our senior nurses, had told me during a break. "I've never seen anyone navigate the Epic system like he does. It's like he speaks the computer's language." I'd felt proud of the trust I'd placed in him. In a profession where burnout was epidemic and good help was scarce, finding someone reliable felt like winning the lottery. Ryan never complained about the extra responsibilities, never questioned the overtime approvals I delegated to him, and never missed a deadline. The first crack in my confidence had come during a staff meeting in early March. Catherine Miller from Human Resources was reviewing our unit's performance metrics when she mentioned something that made my blood run cold. "Your overtime utilization has increased significantly over the past 6 months," she'd said, consulting her tablet. "While your patient satisfaction scores remain excellent, we need to ensure we're managing labor costs effectively." After the meeting, I'd pulled Ryan aside in the break room. "Have you noticed anything unusual about our overtime requests lately?" He'd shrugged, stirring sugar into his coffee with practiced ease. "Nothing out of the ordinary. You know how it is. Flu season, call-outs, the usual staffing challenges. I've been careful to only approve what's absolutely necessary." His answer had seemed reasonable, but something in his tone felt rehearsed. I'd made a mental note to review the overtime reports more carefully, but the demands of patient care had pushed the concern to the back of my mind. The second incident happened 2 weeks later. I'd been covering for a sick colleague when I'd overheard a conversation between 2 nursing assistants from the day shift. "Did you see Ryan's new car?" one had whispered. "That's not exactly CNA salary territory." "Maybe he's got family money," the other had replied. "Or a really good side hustle." I dismissed it at the time. Everyone deserved nice things, and Ryan had always been financially responsible, but the comment had lodged itself in my memory like a splinter. The breaking point came on a Thursday evening in late March. I'd stayed late to complete mandatory training modules when I decided to review our unit's financial reports. What I'd found had made my hands shake as I scrolled through the data. Overtime approvals bearing my employee ID and digital signature, dozens of them, for shifts I'd never authorized. The pattern was sophisticated, approvals scattered across different pay periods, amounts that weren't large enough individually to trigger automatic reviews, but collectively represented thousands of dollars in unauthorized payments. My heart had pounded as I'd cross-referenced the approvals with my own schedule. Overtime authorized while I was in surgery consultations. Approvals timestamped during my vacation days. Digital signatures applied to requests I'd never seen. The most damning had been a series of approvals for Ryan himself. Overtime hours that pushed his weekly total well beyond what any CNA should be earning. Approved during times when I was documented as being in patient care situations where I couldn't possibly have been reviewing administrative requests. I'd printed everything, my hands trembling as the pages emerged from the printer. The trail was overwhelming, but the betrayal cut deeper than the financial fraud. This was someone I'd trusted with sensitive responsibilities, someone I'd defended to administration, someone I'd considered a friend. The next morning, I'd arrived early, hoping to catch Ryan before the shift change. I'd found him at the nurse's station, updating patient boards with his usual efficiency. For a moment watching him work, I'd almost convinced myself there had to be an explanation. "Ryan, I need to speak with you privately," I'd said, my voice steadier than I'd felt. We'd gone to the small conference room near the break area. I'd spread the printouts on the table between us, watching his face as he'd recognized what he was seeing. "I can explain," he'd started, but his voice had lacked conviction. "Explain how my employee ID was used to approve overtime I never authorized? Explain how you've been systematically defrauding the hospital using my credentials." The mask had slipped then. The helpful, efficient Ryan I'd known had been replaced by someone calculating and cold. "You gave me access to those systems," he'd said. "You trusted me with administrative responsibilities. I was just maximizing the opportunities available." "You were stealing," I'd replied, "using my identity to commit fraud." He'd leaned back in his chair, and for the first time since I'd known him, his smile had seemed predatory. "Good luck proving that, Chloe. Your digital signature is on every approval. Your employee ID authorized every transaction. As far as the hospital's concerned, this is your responsibility." The casual cruelty in his voice had been like a physical blow. This person I'd trusted, mentored, and defended had been systematically destroying my career while enriching himself. Worse, he'd been clever enough to ensure that any investigation would point directly at me. As I'd sat in that conference room, staring at of my own professional destruction, I'd realized that Ryan had been planning this betrayal from the beginning. Every favor, every late night he'd stayed to help, every time he'd praised my leadership, it had all been calculated manipulation designed to gain access to the systems he needed to commit his crimes. The silence in the room had been deafening as the full scope of his betrayal became clear. My career, my reputation, and my future at Silver Lake Hospital hung in the balance, and the person responsible was sitting across from me, completely unrepentant. The next morning, I arrived at Silver Lake Hospital with a plan. Ryan's threat had been clear. He'd positioned himself as the victim and me as the perpetrator. But I refused to let his manipulation destroy everything I'd worked for. My first stop was Diana Jackson's office. As the chief nursing officer, she had the authority to initiate a formal investigation and the experience to recognize the patterns I'd uncovered. "Diana, I need to report a serious compliance violation," I said, closing her office door behind me. She looked up from her computer, immediately sensing the gravity in my voice. "What's happened, Chloe?" I laid out methodically the overtime approvals, the pattern of weekend shifts, the suspicious timing of Ryan's requests for system access. Diana listened without interruption, her expression growing more serious with each detail. "These are significant allegations," she said finally. "You understand that this will trigger a full internal investigation." "I understand. But there's something else you need to know. Ryan is claiming that I authorized these transactions. He's trying to frame me for his fraud." Diana's eyes sharpened. "That's a serious accusation to make against a colleague." "It's also the truth. He's been using my employee credentials to cover his tracks. Every fraudulent approval bears my digital signature because he had access to my administrative passwords." The weight of my words settled between us. Diana had been in healthcare administration long enough to understand the implications. If Ryan's version of events gained traction, my career would be over. "I'm going to need you to document everything," Diana said. "Every interaction, every time you gave him system access, every conversation about overtime policies. And Chloe, until this investigation is complete, you're suspended from all administrative duties." The suspension felt like a punch to the gut, even though I'd expected it. "I understand. This isn't a judgment on your guilt or innocence," Diana clarified. "It's standard protocol when financial irregularities involve someone with administrative access." Over the next week, Silver Lake Hospital transformed into a different place for me. Colleagues who had once sought my input on scheduling and policy decisions now avoided eye contact in the hallways. The whispered conversations that stopped when I approached made it clear that news of the investigation had spread throughout the unit. Ryan, meanwhile, continued working his regular shifts as if nothing had happened. I watched him interact with other staff members, noting how he subtly positioned himself as the victim of my, quote, poor oversight. His performance was masterful, just the right amount of confusion and hurt when colleagues asked about the investigation. "I really thought Chloe trusted me," I overheard him telling Catherine Jackson, one of the newer nurses. "I'm just as shocked as everyone else about these financial irregularities. I mean, I helped her with administrative tasks, but I never had independent access to approval systems." The lie was so smooth, so believable, that I felt a chill of recognition. This wasn't opportunistic fraud. It was a carefully orchestrated campaign of professional destruction. My salvation came from an unexpected source. Amanda Jackson, A nurse from the cardiac unit, who occasionally floated to our floor, approached me during my lunch break. "Chloe, can we talk privately?" she asked, glancing around the nearly empty cafeteria. We moved to a corner table, away from the few other staff members eating lunch. Amanda leaned, her voice low but urgent. "I need to tell you something about Ryan. Last month he approached me about covering some overtime shifts on your unit. He said you'd approved the extra staffing but needed someone from outside the unit to avoid budget scrutiny." My heart began racing. What exactly did he say? He claimed you were worried about exceeding your unit's overtime budget, so you wanted to use cardiac unit staff for the extra coverage. He said it was a temporary arrangement while you worked out some scheduling issues. "Did you work those shifts?" Amanda nodded. 3 weekend shifts. Ryan said you'd handle the paperwork and that I'd be paid through your unit's budget. But when I checked my pay stub, the overtime was coded as coming from a special administrative fund. This was the missing piece I'd needed. Ryan hadn't just been approving unauthorized overtime for himself. He'd been creating an entire shadow staffing system, using my credentials to authorize payments that bypassed normal budget oversight. "Amanda, would you be willing to document this conversation for the investigation?" She hesitated, and I could see the conflict in her expression. Speaking up meant potentially making an enemy of Ryan, who was well-liked and had cultivated relationships throughout the hospital. "I know this is difficult," I said, "but if Ryan is willing to manipulate the system this extensively, other people could be at risk." "You're right," Amanda said finally. "I'll talk to Diana Jackson today." That afternoon, I received a call from Diana's office. The investigation had taken a new direction based on Amanda's testimony, and they needed to interview me again. This time, the conference room included Diana, the hospital's compliance officer, and a representative from Human Resources. The atmosphere was more formal, but I sensed a shift in their approach. "Ms. Hayes," the compliance officer began, "we've uncovered that suggests a more complex pattern of financial irregularities than initially reported. Can you walk us through your normal process for authorizing overtime?" I explained the standard protocols, how overtime requests were supposed to be submitted, reviewed, and approved through the hospital's staffing management system. I detailed the safeguards that were supposed to prevent unauthorized approvals and the audit trails that tracked all financial decisions. "At what point did you give Ryan access to these systems?" Diana asked. "I never gave him independent access to approval functions," I said firmly. "He had read-only access to view schedules and staffing reports, which is standard for senior CNAs who help with unit coordination, but he should never have been able to approve overtime or authorize payments." The compliance officer made notes, then looked up with a question that surprised me. "Were you aware that Ryan had been accessing the system using administrative credentials that weren't assigned to him?" "What do you mean?" "Our IT audit shows that the approvals in question were made using a supervisor-level access code that was never officially assigned to Ryan. Someone with administrative privileges would have had to create that access." The room fell silent as the implications became clear. Ryan hadn't just been using my employee ID. He'd somehow gained access to supervisor-level functions that should have been impossible for him to obtain. "We're going to need to expand this investigation," Diana said. "This suggests a more sophisticated breach of our financial systems than we initially understood." Over the following days, the IT audit revealed the full scope of Ryan's deception. He'd been exploiting a vulnerability in the hospital's system integration, using his legitimate access to scheduling software to gain unauthorized entry to financial approval systems. The technical sophistication required suggested he'd been planning this fraud for months, possibly since he'd first started working on my unit. The goulash was overwhelming. Digital logs showed Ryan accessing approval systems during off hours, often from his personal device. The pattern of fraudulent overtime approvals corresponded exactly with his work schedule, and the shadow staffing arrangements Amanda had described were just the tip of the iceberg. When confronted with the technical, Ryan's carefully constructed defense crumbled. His claims that I had authorized his actions became impossible to maintain when the audit showed he'd been accessing systems I'd never given him permission to use. The final confrontation took place in Diana's office, with Ryan, myself, and the compliance team present. It was laid out methodically. the unauthorized system access, the fraudulent approvals, the manipulation of staffing records. Mr. Thompson, Diana said, "that clearly shows that you gained unauthorized access to financial systems and used that access to approve fraudulent overtime payments. Do you have any response to these findings?" Ryan's composure finally broke. The helpful, efficient persona he'd maintained for so long disappeared, replaced by someone bitter and defensive. "You have no idea how hard I work," he said, his voice rising. "I do the job of 3 people on that unit. Chloe gets all the credit while I handle the real work. I deserved that overtime." "That's not your decision to make," the compliance officer replied. "You committed fraud using hospital systems and attempted to frame your supervisor for your crimes." The meeting ended with Ryan's immediate termination and a referral to law enforcement for criminal charges. As he was escorted from the building, I felt a mixture of relief and sadness. The person I'd trusted and mentored had betrayed not just me, but the entire institution we'd both sworn to serve. My administrative privileges were restored the following week, along with a formal apology from hospital leadership. But the damage to relationships within the unit would take longer to heal. Some colleagues who had initially believed Ryan's version of events now seemed embarrassed by their quick judgment, while others remained distant, as if my involvement in the scandal had somehow tainted me permanently. The investigations brought justice, but it also brought a sobering realization about the vulnerability of trust in professional relationships. Ryan's betrayal had been possible because I'd believed in the fundamental decency of a colleague, and he'd exploited that belief with calculated precision. As I sat in my office that evening, reviewing the new security protocols that would prevent similar breaches, I couldn't shake the feeling that something fundamental had changed. The easy trust I'd once placed in colleagues now felt naive, and the collaborative environment I'd worked so hard to build seemed fragile and uncertain.